there is a huge variety of different kinds of vulva appearances and labia appearances, and every one of them is completely normal. So these are most often performed by plastic surgeons, gynecologists, or urologists, and it really depends on the surgeon preference and what your preference is. Typically, there's two techniques that are most often used. One is called a wedge resection, and essentially a triangular shaped portion of tissue is removed from the widest portion of the labia minora, whereas a trim resection is essentially trimming the entire edge of the labia. And in fact, when you look at surveys of surgeons, they perform these pretty much equally, and it really depends on the individual preference of the patient as well as the appearance of the labia themselves. The good news is that most people do really, really well. The risks of this procedure are very low. In fact, about 7% of people need some sort of further surgical revision, and in less than 4%, there's a wound issue that requires you to have kind of a longer healing period or go back for a minor procedure to fix that wound issue. Otherwise, things like chronic pain, infection, pain with sex, or bleeding are really rare in less than 1% of patients.